Welcome, everyone, to the Global Oral Health and Climate Action Conference. I'd like to thank you all for joining us today, and we're looking forward to the next 2 weeks of programming that will be made available to you. My name is Mark Wolf. I'm the Dean at the University of Pennsylvania, one of the sponsors of the COP30 presentations you're seeing today. And I'd like to open with our commitment as a university and as a dental school to supporting the United Nations Sustainable Development Goals. We have a thorough and a very busy schedule for the next 2 weeks with a number of truly world-class speakers available relating oral health and climate action as important themes. This morning, we have some luminaries to join us, and that is absolutely wonderful. And we'd like to start today with a video from the Honorable, there we go, Assistant Minister for Health from the COP30, who will be hosting COP31 in Fiji. Please.
Honorable colleagues, excellencies, distinguished guests, friends, ladies and gentlemen. Bola and a warm Pacific greetings to you all. It is a privilege to join you today. On behalf of the government of Fiji, I warmly congratulate the University of Pennsylvania School of Dental Medicine for hosting this timely conference and for its continuing leadership in sustainability, climate action, and planetary health. Dentistry in a changing world is not just a theme. It is our lived reality. In the Pacific, we are already living on the front lines of climate change. Seas are rising, storms are intensifying, and saltwater intrusion is altering our daily lives. For our small island communities, these are not abstract statistics. They determine whether a mother can reach a clinic or whether a child must endure pain for weeks. After a cyclone, the first building many children search for is the clinic, the place with the light, the chair, and the kind faces that bring relief. When the roof is gone, when water is contaminated, when the generator fails, and the dental chair cannot run, a simple toothache becomes a hospital admission, and a small problem becomes a lifetime burden. This is why we must act together, rapidly and with purpose. The Pacific region cannot address these challenges from within silos. Cross-sectoral collaboration, linking health, water, sanitation, energy, transport, education, and disaster management is the only path toward resilient and equitable oral health. Let me share some concrete examples from Fiji. In maritime regions such as Lau and Lomaiviti, repeated cyclones have damaged clinics and stopped care for weeks. We are now building cyclone-rated, solar-powered, flood-elevated health centers with rainwater harvesting, efficient sterilization, and low water suction unit, ensuring continuity of care even during disasters. Because our people live across scattered islands, fixed sites alone are not enough. Fiji has deployed mobile dental units and boat-supported clinics with solar-enabled portable equipment to reach schools and our communities. When ferries route or air transport are disrupted, mobile care is not a luxury, it is our lifeline. We are embarking into expanding school-based fluoride varnish and physical programs, integrating oral health into non-communicable disease prevention, promoting access to safe water, and reducing sugar consumption through our national health policy. Prevention remains the most sustainable form of care for people and for the planet. In line with the Minamata Convention, we are slowly phasing down the use of mercury amalgam, improving our waste segregation, and favoring environmentally preferable procurement. Infection control measures are being redesigned to reduce single-use plastics where safe and feasible. Yet a challenge still hangs over all these plans: the workforce. The WHO Global Oral Health Action Plan and the Bangkok and Suva declarations reminds us that a fit-for-purpose workforce is essential. Strategic objective number 3 is clear, that we must build a resilient, sustainable workforce that is evenly distributed, that is competent, and must always be supported. In Fiji, we invest heavily in training oral health professionals over 5 to 6 years, but we often lose talent to higher income countries, and too many dentists remain concentrated in urban centers such as Suva, Nandi, and Lotoka. These imbalances deepens inequity across our rural and maritime zones. Now, to bridge that gap, we are pursuing practical Pacific context solution on integrating oral health within our primary healthcare initiative and disaster response team with dental officers, oral health therapists, physicians, nurses, environmental health officers, and community health workers planning and working together. On expanding the scope of dental therapies, dental hygienists, and dental assistants through competency-based training and regulations so that essential services reach communities where they live. On scholarships tied to rural posting, the hardship or rural and maritime allowances provided, continuing education via telehealth, Poland Pacific Open Learning Health Net, and regional specialist outreach, bringing advanced care directly to where our people live. Now on climate smart competencies, embedding training in emergency preparedness, we have established our FEMET team, green procurement, sustainable infection control, and resilient facility management. Now at COP30 here in Belém, we have an opportunity to unite under one voice. Let us shape a global oral health strategy that complement our national climate adaptation and health security plans grounded in preparedness, prevention, safeguarding, and foresight. Fiji's experience from solar-powered maritime clinics to community-based prevention and workforce innovation, it demonstrates that small nations can lead big change, and we are a living proof that sustainable dentistry is achievable when planetary health and human health are treated as one and the same. Now, the question before us is no longer what is the matter, but rather what matters to our people. In Fiji, what matters is that a child on Kandavu can see a clinician after the next storm, that a mother, a grandmother in the Lao group can keep her teeth and her dignity, that our clinics can stand as hub of safety, light, and hope when the winds and sea level water rises. The oral health community has the science. We have the compassion and the ingenuity to meet these moments. Fiji stands ready to share lessons from islands and contribute to the common global agenda, practical, that is equitable, and planetary in its vision. I wish you well in your deliberation in these coming days. Once again, Vinagaba Levu, and thank you for this opportunity.
Thank you very much, Minister. It could not be a better launch of our meeting. It's my pleasure now to introduce Benoit Varenne, the World Health Organization Global Oral Health Program leader coming to us from Switzerland, Benoit.
Colleagues, partners, and friends, good morning, afternoon, or evening, depending on where you are in this planet. It's a true pleasure and privilege to join you today for the launch of the fourth Global Oral Health and Climate Action Conference. So before I begin my presentation, I would like, of course, to express my sincere appreciation to the University of Pennsylvania School of Dental Medicines for hosting this important series of events. Of course, special thanks goes to Julian Fisher, Director of Oral and Planetary Health Policies, whose visionary leadership placed environmental sustainability at the heart of the global oral health agenda, so well ahead of its time. I also would like to warmly acknowledge our Brazilian colleagues who are actively contributing to the preparation for COP30. Your engagement is definitely vital as we work together, to align oral health with broader climate and planetary health goals. So first, why is it so important to be part of these events? Because I think as global health leaders, professionals, we carry a shared responsibility to ensure that the global oral health community, including leaders across government, academia, research, clinical practice, civil society, and dental industry also is actively engaged in addressing the climate crisis. We have all noticed that health is becoming increasingly central to the climate change discussion. Climate change is resulting in poor health outcome, increasing mortality, and driving health inequities. So the main purpose of my presentation, I have few slides today, is really to show that we have a unique and historic opportunity to change how we address oral inequalities and the burden of oral disease in populations, while also protecting the health of people and the planet. So we are living in a time of profound transformation. Global health is so under crisis, but we have this triple planetary crisis, climate change, pollution, and biodiversity loss. It's reshaping the way we think about health and oral health. And today I invite you to see oral health not as a peripheral issue, but as a central pillar of sustainable development and planetary well-being. So as you know, oral disease affect nearly 3.7 billion of people, making them among the most prevalent health conditions globally. So they impair nutrition, speech, self-esteem, and quality of life. But beyond the clinical burden lies a deeper challenge. Oral health systems themselves contribute to environmental degradation. So on this slide, I introduced, the quite well-known life cycle concept traditionally applied to chemicals and products, but I think it fully adapts, to the field of oral health care. So this framework helps us better understand, I think, and navigate the entire ecosystem of oral health from birth to old age. So by viewing oral health through a life cycle lens, we can explore, the evolving needs, services, and systems that shape care across a lifetime. So this approach encourages us to consider not only the clinical intervention, but also the environmental, social, and systemic impact of oral health care. So from the materials we use to the delivery models we adopt and the policy we implement through the mouth of the patients, we have to understand, the impact we may have, in terms of environment. So from mercury in dental amalgam to plastic-based self-care product and disposal clinical materials, the sector generates pollution, consume resources, and emits carbon. So these impacts are no longer invisible. They are urgent, and time to definitely invest on that. So I know that later, I think Nicola Martins and Stefan Mulligan will enter into much more details regarding this life cycle approach. Yes, sorry. So now all the World Health Organization responding to this challenge, I think with bold and integrated action. So the first door, let's say like this, is of course the Global Health Action Plan 2023-2030, with a landmark initiative that set 11 global targets and outlines 100 actionable intervention, to transform oral health worldwide. Among these key priorities, we have a number of actions related to mercury-free dental materials, eco-friendly practices, but also integration of oral health into climate adaptation and emergency preparedness. So this document should be seen as the environment, taking into consideration the environment challenge as a cross-cutting issue in this global action plan. We have one key target related to dental amalgam, and I will discuss a bit later so on this. Was at this time, 90% of countries phasing down or eliminating dental amalgam by 2030. So this aligned, of course, with the Minamata Convention on mercury, a legally binding treaty to protect human health and the environment. And last week, the COP6 was in Geneva, and I will let you know some good news from this COP6. Another aspect and other important element that we have been working, at WHO across a number of consultations, recently, is to release the first-in-kind WHO guideline on environmentally friendly and less invasive oral health care. So it's a landmark step toward sustainable clinical practice. It's based on evidence and provide recommendation regarding the clinical effectiveness, safety, toxicity, cost effectiveness, and environmental impact of dental products and medicines used for the prevention and management of dental caries, and it informed the COP6 discussion that happened again last week in Geneva. So it was a really again international collaboration in partnership with UNEP, with the Jeff also, with the Global Environmental Facilities, funds that support countries, to move and to accelerate, all the activities that help in the case of Minamata Convention to reduce and to ban the mercury in all activities, human activities. So this guideline is now available, and the next month we'll invest a bit of time, to disseminate and to discuss with in each regions, the impact and all these guidelines could help, decision making and policy option in country. Plastic pollution is another urgent concern. Oral health care contributes significantly, from toothbrush, toothpaste, tubes, and packagings, but also dental materials also. Many of these products and materials degrade into microplastic, entering ecosystem and food chains. So the UN Global Plastic Treaty negotiation started with some big issue and delay. Should be, a nice platform, to a timely opportunity to promote alternative to single-use plastics and foster innovation in sustainable materials. So WHO Plastics and Health Initiative advocate for responsible procurement and environmentally sound practices. The inclusion of essential dental medicine and product in what we call the WHO model list of essential medicine reinforces also this agenda, encouraging countries to prioritize sustainable and clinically appropriate materials. Manufacturers have a key role to play, developing biodegradable toothbrushes, refillable toothpaste system, and sustainable packaging. So it's together that we can reshape consumer behavior and reduce environmental harm. So we just launched a new web page initiative we call Oral Health Care and the Environment, and it shows, all for the oral health program and WHO, environmental is really at central as part of the global health agenda. Another occasion, of course, was in Bangkok, November 2024, during this global oral health meeting. And as one of the outcome of this meeting is the Bangkok Declaration, No Health Without Oral Health, adopted by over 100 member states. And now we have this powerful call to action. So it urged countries to minimize carbon emissions, to phase down or phase out mercury-containing amalgam, promote eco-friendly self-care products, but also call for a reduction of single-use plastics. So it aligns with WHO vision for climate-resilient health system, those that anticipate, respond to, and recover from climate shocks while minimizing environmental impact. So of course, it's oral health professional, clinician, researcher, academic, but also all that are active, in the civil society organization that must lead this transformation. Academic institution must educate future practitioners on sustainability principle, telehealth, interprofessional collaboration, and energy efficient clinic design are no longer optional. They are definitely essential. Just a quick note also on the UN high-level meeting that took place a couple of weeks now in New York, and to discuss and adopt, the political declaration on NCD to reshape this agenda, to accelerate and be clear on the commitment from member states and other partners. Unfortunately, as you may know, the political declaration was not adopted during the UN high-level meeting due to few but powerful member states who were not ready for that. We hope it would be the case in upcoming weeks. But just to mention that it's quite a success story for oral health. We have now, as part of this political declaration, a strong paragraph on oral health and integration into, of course, NCD, but also PHC agenda, primary healthcare agenda. And just this slide to show that a number of partners, member states, private sectors have been very active during this week to promote and to help, full consideration of oral health as part of this NCD agenda, but also taking into consideration, environmental issue as well. So now just a slide, because I think it's something that we have to celebrate, the COP6 of the Minimal Convention, to accelerate the ban again of mercury in all human activities, decided, adopted now a deadline to stop import, export, manufacturing of dental amalgam. So I think it's a nice transition also to think about the COP13 in Belém that started today, to position oral health within this climate action and sustainable development. So all these platforms, COP6, I mentioned the Bangkok Declaration, but also the Global Oral Health Action Plan, offer strategic, moment to elevate oral health in global policy dialogues, funding mechanism and implementation strategy. So in conclusion, we need to be prepared, and thanks again to Penn University, Julian Fisher, Mark Wolf, and all the team there to lead this discussion. And with WHO, we are fully mobilized, for these two global events to ensure that oral health contribute to protecting our planet and the health of the population. So the call to action is clear. Oral health must become a cornerstone of sustainable, equitable, and climate-resilient health system. So let's us protect smiles and the planet. Thank you. Over to you, Mark.
Hi, everyone. Welcome to Belém. It's a great pleasure to be here with you today. And I would like to thank the University of Pennsylvania and Dr. Davi Normando for the kind invitation, for the trust my work. My name is Renata Bastos. I am an early career professor and research based in Belém, Brazil, at the University Center of Pará. I believe it's essential for young professionals to be actively engaged in shaping the global oral health and climate action agenda, since our generation will be the most affected by economic, social, and environmental changes. I have been actively involved in my PhD research with indigenous communities of the Amazon, particularly along the Xingu River. COP30 president has announced ambitious thematic days and invited the world to Belém. At the heart of COP30 is the implementation, so our conference is its outcome can support and reinforce the implementation of the WHO Global Oral Health Action Plan and the WHO Bangkok Declaration within the Global Sustainable Development and Climate Action Agenda. I would like to share with you some impressions from COP30 Forum Belém. This picture captures both the beauty of the Amazon and the energy of our people. Like this first photo is the Outeiro Port Terminal. It's capable of receiving larger ships. Here you can see the historic São Brás Municipal Market, one of the landmarks of Belém. Here is Doca Avenue at night. This other photo is Tamandaré Waterway Terminal, an important connection point along the river and some municipalities like Barcarena. And here is the COP30 Amazon Pavilion, the main venue for the conference. So this morning, we are going to talk about briefly what can the indigenous people of the Amazon teach us about orthodontics, and more broadly about health, culture, and shared connection with the planet. Over the years, many studies have been published from this line of research, contributing to a deeper understanding of oral health, craniofacial growth, and the etiology of malocclusion in these populations. Regarding the traditional population, because we are located in the Amazon, in some contact with indigenous communities, we have the unique opportunity to conduct studies among these populations, particularly among the communities along the Xingu River. My research has been developed through a partnership between Federal University of Pará and the State University of Rio de Janeiro, and since then, several studies have been published. Between 2011 and 2016, the construction of Belo Monte Hydroelectric Dam began in the Xingu Valley region. During this period, the area experienced a major influx of outside workers, resulting in substantial displacement and disturbance among indigenous populations. 13 years later, we sought to evaluate the impact of this environmental disruption on dental occlusion. The first find was disheartening. 98% of the indigenous people who had previously shown no tooth loss now presented with at least one missing tooth. Interestingly, this incidence of tooth loss did not differ significantly between the two groups' stories, Arara and Assurini. But women exhibited twice the rate of tooth loss compared to men. These results suggest that the construction of Belo Monte may have contributed to a higher incidence of tooth loss. Therefore, immediate public health policies are mandatory to protect these traditional populations, provide oral health care, especially for women. As we moved forward in this discussion about oral and planetary health, I would like to end with a simple reflection on why we need to frame, measure, and understand oral health within planet health. The same isolated indigenous people of the Amazon need to be cared, seen, and understood. They represent a unique opportunity to explore how genetics and environment interact in shaping dental malocclusions, especially crowned, and more broadly, how human biology mirrors the balance and imbalance of our planet. Or as the Brazilian musician Renato Russo once said, I wish just once to explain what no one seems to understand, that what has happened is still to come and the future is not what it used to be. And I would like to thank you with this presentation and the opportunity to be presented in this event. Thank you.
Dear colleagues and friends, although I cannot be with you in person today, I am very much with you in spirit. This conversation about oral health, climate action, and leadership in uncertain times is one of the most important of our times. My sincere thanks to Professor Mark Wolf, Professor Michael Glick, Dr. Julian Fisher, and the University of Pennsylvania for the kind invitation and for their leadership in advancing this dialogue. I commend everyone gathered here for recognizing that the future of dentistry is inseparable from the future of our planet. The phrase, dentistry is a changing world, captures the reality that surrounds us. Environmental changes, global insecurity, the rapid growth of artificial intelligence, the spread of misinformation, and widening inequalities are transforming how we live, learn, and deliver care. These pressures reach into every corner of our profession, affecting our clinics, our universities, and communities we serve. Extreme environmental events and disruptions in resources will influence both patterns of oral disease and access to care. When we think about the future of dentistry, we must also think about sustainability, resilience, and responsibility. Oral health and environment sustainability must now move forward together as shared priorities. The recent political declaration of the United Nations high-level meeting on non-communicable diseases and mental health also remind us that those most affected by climate change often carry the greatest burden of disease, reinforcing the need for equity and resilience in all our responses. Leadership in uncertain times does not mean leaving all these answers. It means having the courage to act, the ability to listen, and the willingness to collaborate. It calls for strong communication that bridges borders, disciplines, and communities. It also requires sound governance, ensuring that the actions we take today create stronger, more adaptable system for the future. As the global voice of dental profession, FDI is committed to leading with vision, integrity, and accountability. We believe that sustainability is not an option. It is our duty as health professionals and as global citizens. Sustainability is a key theme of FDI strategy under its pillar of innovation. Our goal is to equip the oral health community to ensure that dentistry remains responsible, sustainable, and adaptable to new and emerging technologies. FDI addresses this goal in part through its Sustainability in Dentistry project and its several resources. Our policy statement on sustainability in dentistry serves as an important advocacy tool that national dental associations can use to engage policymakers and promote sustainability oral health care systems. The consensus statement on environmentally sustainable oral health care outlines the challenges ahead and emphasizes that the dental community must provide environmentally responsible care without compromising patients' welfare. FDI's massive open online courses help dental professionals and students understand their role in reducing the environmental impact of dentistry. I encourage you to visit the FDI website to learn more about these courses. The Toolkit for Sustainable Dentistry provides practical, interactive resources that support dental professionals in implementing greener practices and tracking their progress. Through the Pledge for Sustainable Dentistry, signatories recognize the need to align the combined efforts of the oral healthcare sector with the United Nations Sustainable Development Goals and the 2030 Agenda for Sustainable Development. Educational resources are also helping dental schools integrate environmental sustainability into both undergraduate and postgraduate curricula. These initiatives demonstrate FDI's conviction that our profession must lead the transformation toward a sustainable future for oral health. We are not only adapting to change, we are also shaping it, ensuring that dentistry is recognized as a proactive force for environmental well-being. The world around us is changing at great speed, but the values that unite our profession remain constant: service, integrity, and care. The way we lead today will shape the kind of profession and the kind of planet we pass on to the future generations. FDI will continue to support its members with leadership, knowledge, and practical tools to help them act locally while contributing to the global process. FDI stands and will continue to stand by the following principle: dramatically reducing the environmental impact of oral health care requires prioritizing disease prevention over treatment. Together, we can ensure that dentistry not only restores smiles, but also contributes to restoring the health of our planet. Thank you once again for the opportunity to share this message. I wish you all an inspiring and very productive conference.
Dear and respected colleagues, ladies and gentlemen, first of all, I would like to express my sincere thanks to organizers of these remarkable events and the COP30 agenda that became a platform for participants to share their experience and for us to listen to and assist in meeting of faced challenges. It is a great honor for me to speak before you today at COP30 event in the vibrant and amazing people of Brazil. A year before, the 29th session of Conference the Parties to the United Nations Framework Convention on Climate Change was held in Azerbaijan. This global event that took place in Baku showed us how solidarity can lead to positive achievements in fighting climate-related challenges. The decisions that were made during several days events, including roundtables, bilateral and multilateral meetings, with the participation of thousands of guests from abroad under the umbrella of the COP29, displayed the high spirit of that solidarity and strong will to reach the goals. Thanks to our country's successful chairmanship and high-level diplomatic skills, historic results were achieved in the global climate agenda. For the first time in history, an agreement was reached on the Baku financial goal, which includes the allocation of climate finance with core targets, marking a significant milestone in the fight against climate change. This achievement, which set the high level of goals and previous financial commitments, paved the path for a new wave of global investment. Despite serious steps taken in the direction of solution of climate change-related problems, we still face global challenges, such as pollution and loss of biodiversity. We must convey to people and particularly stakeholders that oral health cannot be viewed separately from the environment, as these two are closely linked, also are the sustainability of societies and well-being of every person. Solution of above noted problem is impossible without a complex approach, because we see how ecosystem change as well as climate change impact oral health. So altogether, we must use this new paradigm to change the way we practice dental care and pay more attention to prevention and long-term sustainability. Azerbaijan is strongly committed to the United Nations Sustainable Development Goals and the World Health Organization's Oral Health Strategic Action Plan, which includes main objectives like health improving, also ensuring the access to education in order to achieve this sustainable development. Today, we continue that journey together with new goals and deeper understanding. As president of the Azerbaijan Dental Association, I am here to stress once again that health, especially oral health, cannot be divided from the health of our planet. The air we breathe, the water we drink, the food we consume, they all form the base of human well-being, including our smiles. When the environment is damaged, so is a human health. Climate-driven challenges from pollution to drought do affect the patterns of oral disease, nutrition, and access to care. Dentistry, like all medical fields, must develop to face this new reality. We must design sustainable dental systems, reducing waste, saving water, and integrating eco-friendly materials. Even more, we should educate that to prevent fall-offs from too away, and together we can consolidate the message that protecting the planet is also protecting our patients. COP29 once again demonstrated that strong multilateral cooperation can deliver real and tangible results. With this successful conference, Azerbaijan set a positive precedent for the success of future global COP events and made significant contribution to climate effort worldwide. That spirit continues here in Brazil, where nature itself remains as balance, renewal, and resilience. Our two nations, despite being far from each other, are being bound by a shared vision of the future where health systems are not only efficient, but environmentally responsive. Let this conference be more than a dialogue. Let it be a promise that the healing professions will be led by the best example, integrating sustainability into every decision we make. The crossing of health and climate is not future, but our present responsibility. Together, from Baku to Brasilia, we can ensure that every next generation inherits not only a healthier planet, but the one where every smile reflects the harmony between people and nature. Thank you very much for attention. Best wishes.
Thank you, Dean Wolf, and I'd like to add my thanks to you and the University of Pennsylvania and Dr. Julian Fisher for pulling this important conference together. There's very few other organizations that are really taking a hard look at sustainable global oral health, and I think this is an important conference, and we're going to learn a lot over the next few days. So I also want to thank you for recognizing the role that research will play in addressing these challenges that we've heard over the last 49 minutes. We're not going to progress without research. So research needs to be integral into our approach here. And of course, we need to be thinking about climate change, not only the impact that climate change has on the healthcare sector, as this Assistant Minister of Health was outlining, a child that can't get to the clinic because of flooding in some of the Pacific nations, and there's lots of other examples where climate change is impacting delivery of healthcare all over the world. But then also, what is the oral health profession's contribution to climate change, as it's been outlined very well by Dr. Varen and others, in terms of the products that we use, the packaging that we use, the waste that we're generating in the dental clinics, but then also what happens at home with prevention, as Dr. Varen also outlined, the toothbrushes that are largely made of plastic that only last 3 months, and not everybody does this, but you're supposed to throw it away after 3 months, but that's an incredible amount of waste. I'm happy to see that some of the major manufacturers have now moved only recently in the last couple of years to recyclable toothpaste tubes. And that's sort of a new development. And that's great that the multinational companies are paying attention to this area as well. And really, in addition to research being important to addressing the challenges here, we need to bring in the private sector. And of course, they're investing in research also to minimize the footprint that oral health care has on the planet. So Dr. Fisher asked me to bring up specifically IDR's involvement in the Minamata Convention on Mercury process, and has been outlined already. We just had our COP6, or Conference of the Parties 6 meeting last week in Geneva. But this has been a very long process, and Dr. Fisher was there at some of the beginning negotiations, but it really started in 2009 when the United Nations Environmental Program called for an environmental treaty on eliminating mercury in the environment. And then we had several INCs, or International Negotiating Committees, to agree to the text. This went on from 2009 to 2013 when they finally agreed to the text, and then it went into effect a few years after that. And now we're on our 6th Conference of the Parties. Now, the reason why dentistry is involved in an environmental treaty, and it was quite unusual back then for sure, was of course because of dental amalgam. And there were some very active NGOs that wanted to simply ban dental amalgam tomorrow, back in 2009 when this was negotiated. But we do know from research from the National Institutes, the U.S. National Institutes of Dental and Craniofacial Research, that dental amalgam is a safe product for patients with a few exceptions of allergies. So it's safe to be used. And at that time, it was really very important to the dental profession that we had that as a clinical choice for our patients. And without that, the alternative may be extraction. And in the treaty, the provisions under dental amalgam really could be looked at in this broader picture of global oral health and sustainability also, because it called for prevention. Prevention is going to be the #1 reason why we don't need any dental restorative. So we can be talking about the sustainability in oral health care, that prevention is going to generate the least waste as opposed to treatment. And then it also called for research into mercury-free alternatives. Again, the importance of research, that we didn't have the products that we needed at that time, and we needed research to develop those products. And that research came from both the public sector, NIH and NIDCR invested heavily in different resin models, resin systems to replace dental amalgam, and the private sector, the companies that make dental composites, as well as glass ionomer cements and hybrid glass ionomers. So these products have advanced tremendously, and I think we're getting close to the point. We are close to the point, and this guideline that Dr. Varen just mentioned talks about how we do have the materials that we do need to replace dental amalgam. And this COP6 meeting, there was a proposal from our African colleagues to ban dental amalgam in the year 2030. And as an NGO, we don't have any vote in the Conference of the Parties and what the countries adopt, but some of the countries, that was a little too soon for them. So the agreement and the consensus, if you've been involved in any of these processes, they really try to move forward only once they have consensus. And by consensus, I mean almost unanimity. That 2034 was the better date for some countries. That's not to say any country that can phase out dental amalgam tomorrow, they can, and that would be applauded. But the countries as a whole needed 2034. A few countries needed to get to 2034. And then importantly, also, there were some exceptions in there, even though it's banned after 2034, there are some exceptions built into that But that doesn't mean dental amalgam is going to go on forever. Even with the exceptions, there's going to be a review of those exceptions and why are they really needed. So we're really on the time course for a rapid eventual phase out by 2034 of dental amalgam under the leadership of UNEP and WHO and others. And IADR as a NGO in official relations with the WHO that we're quite proud of, along with my colleagues at the FDI, who you just heard the video from Dr. Nicholas, are in official relations with WHO, and we've been working very closely together to get to this point. So I'll have a little bit more details on this whole process and the role of IADR and in research into this. And again, I want to thank Dean Wolf and Julian Fisher and everybody. I learned so much just in this quick hour of introduction, and I look forward to the sessions later in the week. So over to you.
Thank you so much, Chris, for your comments and insights and for continuously supporting a research agenda going forward. I would like to thank everybody who has been on board and listened to this morning's session. And as Chris has so elegantly said, we've been able to learn so much in such a short period of time. We will post the location where you can reach the full schedule for the COP events that we'll be holding related to oral health, but I will call to your attention tomorrow's sessions where we'll be speaking about building a sustainable healthcare practice, both the how and why. Another session on driving innovation to meet future challenges, research and education in dental schools, and a session on oral and respiratory health, the implications for dentistry. As you can see from the three titles that are involved here, this is an incredibly vibrant discussion of how oral health is intimate to the discussions of healthcare as well as the environment in which we live and practice every day. On Wednesday, we will have sessions on diversity of artificial intelligence in dentistry, towards more sustainable practice, planetary threats as economic Achilles heel of dental practices. We will speak on Thursday about water at the heart of health security and emergency preparedness plans. Another session on integrating planetary health into clinical and public health evidence-informed practice guidelines. A session on Friday. We have three great sessions talking about improving oral health inequities through transdisciplinary and team-based approaches. A session on early childhood education as the first line of NCD and climate resilience prevention. And another session on achieving oral and planetary health, how sports dental medicine can pioneer and realize a transformation in oral health. The following week, we'll have a series of programs on Monday, Health Policy in a Changing World, the critical role of research in environmental sustainability and oral health, minimum intervention, oral care, and sustainable nexus. Session 15 on Tuesday will be reimagining dental education through the lens of planetary health and One Health, prevalence of oral pathologies amid extreme weather events in vulnerable communities in low and middle income countries. Wednesday, we'll have traditional oral health practices and a session on circular economy and full life cycle assessment. Thursday, sustainability in dentistry, how manufacturers and suppliers can support innovation and assure environmental and social responsibility, evidence-based pathways for microbiome-centric prevention and early management of dental caries. And session 20 would be oral health systems for health security, a call for integration. And on the final day of the conference, we will have three absolutely wonderful sessions followed by the conference closing, including a student voice Planetary Health for All in All Policies, a case study, and developing One Health Policy and Advocacy for Climate Action and Planetary Health, and conference closing. Before I say thank you for being here, I need to thank first Julian Fisher, who is an adjunct professor at our school and responsible as Director of Oral and Planetary Health Policies at Penn Dental Medicine, for organizing this program. We're just so happy he's been able to do so. He is in our global center, our Center for Global Integrative Oral Health. I do also need to thank our team at Penn, who makes these events come off looking so easy and well coordinated, led by Pam Rice. We will have a team of people over the next 2 weeks working to bring this to us, and then making it available at later dates for people to be able to review these sessions. I would like to thank Benoit, Chris, Renata, and Irina for spending the time with us this morning in bringing this to, well, this morning, and for others this afternoon, for bringing this together for everybody. And I hope everybody enjoys the COP30 events. Thank you very much.